Hello, this is Patient X Files, where the rare becomes real. Her blood was turning black. I've never told anyone this story before. Not because I was asked to keep it secret, but because every time I try to speak about it, something inside me freezes. Like my body remembers what it was like to watch someone's life drain away in the most impossible way. Not through bleeding, not through violence, but through something far more terrifying. Through their own blood betraying them from within. It was a Tuesday morning in October when Sarah walked into our emergency room. Nothing about her entrance suggested the medical mystery that would consume our entire team for the next 72 hours. She looked like any other 26-year-old woman dealing with flu-like symptoms. Tired, slightly pale, complaining of shortness of breath. Her boyfriend held her elbow as she shuffled to the reception desk, and I remember thinking how sweet it was that he'd taken time off work to accompany her for what seemed like a routine visit. But Sarah wasn't routine. Nothing about Sarah would ever be routine again. The first sign something was wrong came when the nurse tried to draw blood for standard labs. The needle went in clean, no complications, but what came out into the vial made her step back and call for the attending physician immediately. The blood wasn't red. It wasn't even dark red like you'd expect from venous blood. It was brown. Dark brown like chocolate milk, like something that had been sitting in the sun too long, like something that belonged in a horror movie rather than a human body. "Doctor, you need to see this," the nurse whispered, holding up the vial with trembling hands. "I've been in emergency medicine for 15 years. I've seen blood in every possible state, clotted, infected, thin, thick. But I had never seen blood that looked like this. It looked dead. It looked like it had given up on being blood." Sarah's boyfriend saw it too. The color drained from his face as he stared at the vial, then at Sarah, then back at the vial. "What does that mean?" he asked, his voice barely above a whisper. "Why is her blood that color?" The truth is, we didn't know, not yet. Sarah was struggling to breathe despite having normal lung sounds. Her pulse oximeter readings were confusing. They showed adequate oxygen saturation, but she was clearly in distress. Her lips had a slight blue tinge. Her fingernails were dusky, and she complained of feeling exhausted despite having slept well the night before. Most disturbing of all, her skin had taken on a grayish hue that seemed to intensify under the fluorescent hospital lights. "I feel like I'm suffocating," she told me, gripping my arm with surprising strength. "But I can breathe. I don't understand what's happening to me." Neither did we, not at first. We ran every test we could think of. Blood gas analysis, complete blood count, comprehensive metabolic panel, toxicology screen. The results painted a picture that didn't make medical sense. Her oxygen levels appeared normal on some tests, but critically low on others. Her hemoglobin levels were adequate, but something was fundamentally wrong with how her blood was functioning. Then Dr. Martinez, our senior attending, walked into the room and took one look at Sarah's chocolate-colored blood sample. His face went pale. "Run a methemoglobin level," he ordered quietly. "Run it now." I'd heard of methemoglobinemia in medical school, buried somewhere in the pages of textbooks dedicated to rare blood disorders. It was one of those conditions that medical students memorize for exams and then promptly forget because the chances of encountering it in real practice are so slim. But Dr. Martinez had seen it before, decades earlier during his residency, and he recognized the signs immediately. Methemoglobinemia occurs when hemoglobin in the blood becomes oxidized and transforms into methemoglobin, a form of hemoglobin that cannot carry oxygen effectively. Instead of the bright red color we associate with healthy, oxygen-rich blood, methemoglobin gives blood a dark, brownish appearance. Patients with high levels of methemoglobin essentially suffocate at the cellular level, even while breathing normally. The test results came back within an hour. Sarah's methemoglobin level was 42%. Normal levels are less than 1%. At levels above 20%, patients begin experiencing severe symptoms. At levels above 50%, the condition becomes life-threatening. Sarah was teetering on the edge of a medical emergency, but knowing what was wrong with Sarah was only half the battle. The more pressing question was why this was happening to her. Methemoglobinemia doesn't just occur spontaneously in healthy young adults. Something had triggered this transformation in her blood, and we needed to find out what before her condition deteriorated further. The detective work began immediately. We questioned Sarah and her boyfriend about everything she'd consumed in the past week, every medication, every supplement, every food item. We asked about her work environment, hobbies, recent travels, possible exposure to chemicals. The list of potential triggers for methemoglobinemia is long and diverse. Certain antibiotics, local anesthetics, industrial chemicals, nitrites, even some over-the-counter medications. Sarah worked as a graphic designer from her home office. She hadn't traveled recently, didn't take any medications, followed a relatively healthy diet. She seemed like the last person who would develop such a rare and dangerous blood disorder. Her boyfriend was equally baffled. They'd been together for 3 years and he'd never seen her sick with anything more serious than a common cold. Then Sarah's mother called. The phone rang as we were preparing to start treatment with methylene blue, the antidote for methemoglobinemia. Sarah's mother had heard about the hospital visit from her boyfriend and was calling to check in. During the conversation, she mentioned something that made everyone in the room stop what they were doing. "Oh, honey," her mother said over speakerphone. "Did you remember to tell the doctors about those dietary supplements you started taking last week? The ones for anemia that your friend recommended?" Sarah's eyes widened. She'd completely forgotten about the iron supplements she'd purchased from an online retailer after a friend suggested they might help with her chronic fatigue. The supplements weren't FDA approved, came from an overseas manufacturer, and the packaging was entirely in a foreign language she couldn't read. We obtained a sample of the supplements and sent them for emergency analysis. What came back shocked even our most experienced pharmacist. The pills contained massive amounts of nitrates, far exceeding any safe dosage. They also contained several unlisted ingredients, including industrial compounds that had no business being in any substance intended for human consumption. Sarah had been unknowingly poisoning herself for a week, taking what she thought were harmless iron supplements but were actually causing her hemoglobin to oxidize and transform into the life-threatening compound that was slowly suffocating her at the cellular level. The irony was devastating. She'd started taking the supplements because she'd been feeling tired and run down. The supplements were making her exponentially worse, creating a vicious cycle where she felt increasingly fatigued and continued taking more pills, accelerating the transformation of her blood into something that couldn't sustain life. Treatment began immediately. Methylene blue, administered intravenously, acts as an electron donor that helps convert methemoglobin back to normal hemoglobin. Within minutes of starting the infusion, Sarah's blood began changing color. The chocolate brown gradually shifted to a dark red, then to the bright, healthy red we associate with properly functioning blood. But the visual transformation was nothing compared to the change in Sarah herself. As her blood regained its ability to carry oxygen, her breathing became easier. Her skin tone improved, and the crushing fatigue that had plagued her for weeks began to lift. It was like watching someone come back to life in real time. "I can breathe," she whispered, tears streaming down her face. "I can actually breathe." Her boyfriend collapsed into the chair beside her bed, overwhelmed by relief. For hours, he'd watched the woman he loved struggle with a mysterious condition that none of us could immediately explain. The fear in his eyes had been heartbreaking. The terror of watching someone you care about suffer from something invisible and incomprehensible. Sarah's recovery was remarkable but not immediate. It took several days for her methemoglobin levels to return to normal, and weeks for her body to fully recover from the chronic oxygen deprivation she'd endured. The fatigue she'd been experiencing for months wasn't just normal tiredness. It had been her body's cry for help as her blood slowly lost its ability to sustain her. The supplements were removed from online sales immediately after our report to the FDA. Investigation revealed that dozens of other customers had purchased the same product, though Sarah appeared to be the only one who developed such severe symptoms. Some people are genetically predisposed to methemoglobinemia and react more severely to triggers that might only cause mild symptoms in others. Sarah learned she carried a genetic variant that made her particularly susceptible to this condition. It was information that would shape her medical care for the rest of her life, but also information that potentially saved her life. Without knowing about her genetic predisposition, she might have continued taking supplements or medications that could trigger another episode. The case changed how our entire emergency department approaches patients with unexplained fatigue and breathing difficulties. We now ask more detailed questions about supplements, especially those purchased online from overseas manufacturers. We've identified 3 more cases of supplement-induced methemoglobinemia in the past year alone, catching them early because of what we learned from Sarah's experience. But beyond the medical implications, Sarah's story haunts me because of how easily it could happen to anyone. She made a decision that millions of people make every day. She bought supplements online to address a health concern. She trusted that products marketed for human consumption were safe. She assumed that her fatigue was just stress or poor sleep habits, not a life-threatening blood disorder. The supplements she took were marketed as natural iron boosters with ancient herbal ingredients. The advertising promised increased energy, improved vitality, and enhanced overall wellness. Nothing in the marketing materials mentioned nitrates, industrial compounds, or the risk of methemoglobinemia. The packaging looked professional, the website seemed legitimate, and the price was reasonable. Sarah's case illustrates the terrifying gap between consumer assumptions about supplement safety and the reality of an industry with minimal regulation. We trust that products sold for human consumption have been tested for safety, but the supplement industry operates under very different rules than pharmaceutical companies. Many supplements reach consumers without rigorous testing, quality control, or oversight. The global nature of online commerce makes the problem even more complex. Sarah's supplements were manufactured in a facility that had never been inspected by FDA officials. The raw materials came from suppliers with no quality control standards. The final product contained ingredients that weren't listed on the label and lacked ingredients that were supposed to be included. What makes Sarah's story even more disturbing is how common it's becoming. Our emergency department sees increasing numbers of patients with mysterious symptoms that eventually trace back to supplements, especially those purchased online. Most cases aren't as dramatic as methemoglobinemia, but they represent a growing trend of supplement-related health problems that are difficult to diagnose because patients often don't think to mention supplements when discussing their medical history. The psychological impact on Sarah extended far beyond the physical symptoms. She struggled with guilt over taking the supplements in the first place, anger at the company that sold them, and fear about what other products in her home might be dangerous. She became hypervigilant about everything she consumed, reading ingredient lists obsessively and researching every product extensively before use. Her boyfriend experienced his own trauma from watching her suffer through a medical mystery that seemed to have no explanation. He later told me that the image of her chocolate-colored blood haunted his dreams for months. The helplessness of watching someone you love battle an invisible enemy leaves lasting emotional scars. The financial impact was significant as well. Even with insurance, Sarah's emergency department visits, laboratory tests, treatments, and follow-up care resulted in thousands of dollars in medical bills. The supplement company had dissolved by the time she tried to seek compensation, leaving her responsible for medical costs that resulted from their negligence. Sarah's case also highlighted gaps in our medical education system. Despite years of training, most of the medical team had never encountered methemoglobinemia in clinical practice. We knew about it theoretically, but hadn't developed the pattern recognition skills necessary for quick diagnosis. Sarah's condition could have been identified hours earlier if we'd been more familiar with its presentation. The incident prompted our hospital to implement new training protocols for rare blood disorders. We now conduct regular case studies on conditions like methemoglobinemia, ensuring that current and future medical professionals are better prepared to recognize unusual presentations. Sarah's case has become part of our standard curriculum for emergency medicine residents. 6 months after her initial presentation, Sarah returned to our emergency department with concerning symptoms during a routine illness. This time, we immediately checked her methemoglobin levels and discovered a mild elevation that required monitoring but not treatment. Her genetic predisposition meant that even common medications and minor infections could potentially trigger episodes, making her ongoing medical care more complex. She'd become an expert on her own condition, carrying detailed medical information and maintaining relationships with specialists who understood methemoglobinemia. She'd also become an advocate for supplement safety, sharing her story with regulatory agencies and consumer protection organizations. The transformation in Sarah's approach to healthcare was remarkable. She'd gone from someone who rarely saw doctors and self-medicated with online supplements to someone who maintained detailed health records and worked closely with medical professionals to manage her genetic predisposition. The experience had taught her that taking control of her health meant partnering with qualified professionals, not replacing them with internet research and unregulated products. Her story spread through social media and medical communities, serving as a cautionary tale about supplement safety and the importance of medical oversight. Other patients with similar experiences reached out to share their stories, creating an informal network of people who'd suffered adverse reactions to unregulated supplements. The regulatory response to Sarah's case and others like it has been frustratingly slow. While the specific supplements she took were removed from the market, similar products continue to be sold with minimal oversight. The fundamental problems with supplement regulation remain largely unchanged, leaving consumers vulnerable to similar experiences. Sarah now works with patient advocacy groups to push for stronger supplement regulations and better consumer education. She speaks at medical conferences about her experience and has testified before regulatory committees about the need for improved oversight of online supplement sales. Her relationship with her boyfriend deepened through the crisis, but not without challenges. Medical emergencies test relationships in unexpected ways, revealing strengths and vulnerabilities that might not emerge under normal circumstances. They attended counseling together to process the trauma of her illness and developed stronger communication skills around health and medical decisions. The long-term health implications of Sarah's methemoglobinemia episode are still being studied. While she recovered fully from the acute phase, doctors continue monitoring her for potential long-term effects of chronic oxygen deprivation. Some research suggests that severe methemoglobinemia episodes can have lasting cardiovascular consequences, though Sarah shows no signs of complications at this point. Her genetic counselor recommended screening for other family members who might carry the same genetic variants that predisposed her to methemoglobinemia. 2 of her cousins tested positive for similar genetic markers, giving them valuable information about their own susceptibility to the condition. The case also influenced our hospital's approach to genetic testing and counseling. We now offer genetic screening for methemoglobinemia predisposition to patients with unexplained fatigue or breathing difficulties, especially those with family histories of unusual reactions to medications or supplements. Sarah's story continues to evolve as researchers learn more about methemoglobinemia and genetic predisposition factors. She participates in research studies designed to better understand the condition and improve treatment protocols for future patients. Today, 3 years after her initial presentation, Sarah maintains excellent health through careful medical management and lifestyle modifications. She avoids supplements entirely, works closely with a hematologist familiar with her condition, and carries emergency medical information in case of future episodes. Her experience fundamentally changed how she views the relationship between consumers and the healthcare industry. She learned that taking responsibility for her health meant educating herself about medical conditions while also recognizing the limits of self-diagnosis and self-treatment. The chocolate-colored blood that nearly killed her became a symbol of the hidden dangers in products we trust to improve our health. Her story serves as a reminder that the pursuit of wellness can sometimes lead us into unexpected dangers, and that the most life-threatening conditions often begin with the most innocent decisions. If you enjoyed this video, please support the channel, like, share, and subscribe. Please write a comment what you think about this video.